at a national perspective via Google Hangout, and then welcome back to the show Lisa Zamofsky, healthcare journalist and author of Healthcare Insurance and You, The Savvy Consumer's Guide. Also works for WebMD and the LA Times. I got to believe, Lisa, you're like a CPA at tax time. My gosh, your area of expertise is making headlines every day of the week. Let's just dive right in with what you are seeing. What questions are you getting from people? What's bubbling up for you?
Well, it's interesting that you bring up CPAs because I feel as though I possibly should have went out and gotten one myself, because interestingly, people who are trying to sign up have a tremendous amount of questions about taxes, because as you know, with subsidies, that's a really big part of it. How much do you earn? What counts as as taxable income? Those kinds of things. So that's a big question. And then, of course, a lot of confusion still about who's eligible, who can shop the marketplaces, and definitely a lot of questions related to what you're talking about tonight, which is people in states like Missouri, Texas, Florida, who don't earn a lot of money and are concerned about how they're going to get coverage because they live in a state not expanding Medicaid.
Back up one step. We talked about this before with you. Who is confused? What do you want them to know about who should be shopping on the website when it does work, and other things in the marketplace?
Yeah, I think probably the most common two questions I get are from people who have Medicare coverage and are asking if they can either buy different kinds of plans, a Medicare supplement plan, or if they should drop their current coverage and shop on the marketplace. And the answer to that is no. If you have Medicare, Medicaid, you're covered through the VA, you're covered. You don't need to do anything. The marketplaces are not for you. And the people with employer coverage want to know either should they be shopping on the marketplace, but more commonly, can they find a better deal on the marketplace? Because many are under the impression that either free or low-cost health insurance is available there. And of course, it is for many millions of Americans. But if you have affordable coverage through work, you're not eligible for those tax credits. And in most cases, probably better off staying with your work-based plan.
Okay, let's go back to the other thing you brought up, which is what we were just talking about at the table, that gap that we have in Missouri. We're not the only ones. What are you seeing around the country? How is that playing out around the country?
Yeah, so I believe there are about 24 states right now that are not eligible, that are not expanding, and so those folks in the gap will not be eligible for Medicaid, and it's a huge problem. Really the law won't help them. I don't know how much worse it will make it for them, except for the fact that perhaps those that rely on many of the community-based clinics and safety net hospitals, I think some of those providers, as some of your speakers already alluded to, will probably be further stretched with the implementation of the law. Those folks have been without great options for coverage. They're usually not offered coverage through an employer. They can't afford to buy coverage on their own, and certainly without the help of subsidies, if they fall below poverty, which is less than $12,000 a year, buying an insurance plan without any financial help for most will be impossible.
We heard it mentioned at the top of the show that states that have their own exchange, their own marketplace, are doing better than those like Missouri who are relying on healthcare.gov and the federal marketplace. Do you buy that analysis?
Yeah, that does seem to be the case. I mean, there are certainly states that are not doing well. There was a big story out, unfortunately, just last week, or was it earlier this week, about Oregon, which started off really promisingly and really has had a tremendous amount of IT problems. They, to my knowledge, based on the last reports I've seen, have not been successful in signing up even one resident so far, and that's a state-based. Kentucky and Washington State, on the other hand, are doing a stellar job and are some of the real stars in all of this. So healthcare in general is incredibly local. It always has been, and that seems to continue to be the case. But generally speaking, yes, you have a better shot if your state's running a marketplace. Generally, again, Oregon's having some tough times, but it is easier for those folks to sign up than those reliant on the federal system right now.
The other big story lately has been, we've touched on it a little bit already, but that the president said if you could keep your plan, if you liked it, you could keep it, and that has not been the case. Where do you see that storyline going? What's the latest on that?
The latest on that is that there are about 14 million people in this country who buy insurance on their own, and probably about half of those are having to I mean, the numbers aren't concrete, but there are many millions of people who will have to change plans. Their plan is being canceled, but it's not as though they're being dumped out into the street on their own. They're being offered an alternative. And
which can be more expensive. Some have said more expensive options.
Yeah, that's right. If you qualify for a tax subsidy, it could be a lot less expensive than what you've been paying. But for folks who don't, I am hearing from a lot of consumers complaining that their rates are going up, in some cases quite significantly.
Lisa Zamosky, thanks for your time. We appreciate you, as always, being on the show and bringing us some national perspective. Thank you very much.
Great to be here. Thank you.